The GLP-1 semaglutide is the active ingredient in Ozempic. So, after a few years of success treating type 2 diabetes, manufacturer Novo Nordisk decided to seek FDA approval for Wegovy as a weight loss drug. Still semaglutide, but in higher doses. Dr. Angelina runs the IBI Healthcare Institute in Atlanta.
The active ingredient of those medications, GLP-1, which is a natural occurrent hormone in our body, been noted to go up after someone had bariatric weight loss surgery. So when they notice that, then they start looking at that compound and saying, we can use it to decrease diabetes or to help people lose weight.
Another drug, tirzepatide, is the active ingredient in Mounjaro. That's the Eli Lilly version of GLP-1. It's not FDA approved for weight loss, not yet, but doctors can still prescribe it legally for non-diabetics, something that's called off-label prescription. Dr. Pistoyev tells me both drugs have had remarkable results in clinical trials.
Same class of medication, different manufacturers, 17 to 22% of weight loss. Some of the medications they plan to come out with in the next few years might go as far as 24% of weight loss. So it's a still improving field. So very exciting.
Two important caveats here. These drugs are expensive, especially when prescribed off-label, because insurance rarely covers such cases. And secondly, they're not magic pills, or actually injections, and you do still have to do some work.
This medication needs to be combined with lifestyle changes, lifestyle changes, some exercise. Usually it doesn't have to be anything excessive. So the way I counsel my patients, it has to be something that you can maintain even without medication. So I don't want you to go starving. I don't want you to exclude any crazy foods, like no carbs forever. That's not sustainable.
But importantly, these drugs work on the most vital bodily organ related to obesity, and it's not your stomach.
The medication works on your brain, on the brain center that actually controls those urges, right? So once that's controlled, then we can actually take a deep breath and say, now I can get up and go do this extra stuff.
Dr. Pistoyev says supplies have been somewhat limited, but she insists treating obesity is important, and successfully doing so may well prevent someone from becoming diabetic. So
if I feel like I need to give this medication to save my patient who doesn't have diabetes yet, I absolutely can.
More broadly, she believes these medications could be a game changer for millions of Americans.
I'm glad we're talking about it. I'm glad people are learning about it, because obesity is a huge issue that people have been told for years that is their fault. And I feel like we really need to just kind of step up the education, saying obesity has surgical management, has medical management, and that there's hope, and we can help a lot of people this way.
Russell Mills, 102.3 KRMG, Tulsa's News and Talk.